The following is an instructional video for the SafetyFix Easy Out bone screw. Explantation can be performed under local anesthesia in a sterile environment. Most patients should require only a few cc's of local anesthesia directly over the incision site. In patients that are anxious or hypersensitive, a larger field block or IV sedation can be used. A sterile field should be set up, which includes a SafetyFix driver, a large needle holder, and optionally the SafetyFix lifting fork. It is also advisable to have the patient's postoperative x-rays, which demonstrate the position and angular attitude of the screws. Standby fluoroscopy can also be utilized if the surgeon desires. Screw location should be accomplished externally utilizing palpation, locating the screw head with a 27-gauge needle via palpation, or locating with a 27-gauge needle and fluoroscopy if necessary. In most cases, the screw head can easily be palpated under the skin. We do, however, additionally recommend utilizing a 27-gauge needle to exactly locate the position of the screw head under the skin for the most accurate incision placement. The minimum incision line for explantation is 4 to 10 millimeters in length. This incision should be located directly over the screw head. Next, a small hemostat can be utilized to gently separate the soft tissues directly above the screw. Next, the SafetyFix driver is inserted into the wound. Holding the driver like a pencil, the head can best be located. The SafetyFix driver was designed to have up to 30 degrees of freedom when engaging with the screw head. This design allows for engagement of the driver with the screw head from multiple angles, facilitating easy removal. While the most optimal incision planning will allow for direct contact at 180 degrees, sometimes incisions that are slightly off-center are necessary and allow for removal engaging the head at different angles. When the head is firmly within the driver and there is resistance, a reverse counterclockwise torque can be accomplished to start backing the screw out. The screw head should be visible exiting the wound. Completely remove the screw and close the wound with 1 or 2 simple sutures. Additional removal tips. During the removal process, if the screw loses purchase, there are 2 methods for explanting the screw. Utilize the needle holder to grasp both sides of the square-headed screw and twist counterclockwise with light traction to remove the screw. Method 2. The fork technique. Utilizing the lifting fork. The lifting fork is a small instrument designed to help facilitate explantation of screws that have lost purchase. The fork is designed to allow for positioning within very small incisions. In step 1, you position the fork around the shaft of the screw, under the head of the screw, and provide mild leverage. Next, engage the screw head with the driver and rotate counterclockwise. The leverage provided by the lifting fork will provide enough to allow for the screw to come out. During this process, screw threads may re-engage the bone, allowing for the driver to do most of the work. If the screw does not re-engage, simply providing leverage with the lifting fork will allow the screw to easily explant. The following are additional pearls. Number 1. It is common to visualize the head of the screw within the surgical site and within the soft tissues. Numeral 2. The SafetyFix driver can be rotated at various angles to properly seat on the screw head. Numeral 3. Use of an ankle tourniquet or epinephrine will help keep the surgical site clear of bleeding and facilitate visual identification of the screw head. Number 4. Occasionally, an explantation may be made more difficult by poor incision placement. Because of the small size of the incision it's important to attempt to make incisions accurately and directly over the screw head. Visualization of postoperative X-rays will indicate the angle of the screw head, which will determine incision placement and help keep incisions small. If necessary, lengthen the incision appropriately in order to achieve satisfactory position of the driver. Incision lengths up to 1 inch are sometimes necessary for difficult explantations. Commonly, explantations require only a 10 mm or less incision.